Good morning, everyone. I'm Kimberly Chalia with PHCA. Thanks so much for joining us for today's webinar. I have a few quick updates before we get started today. The webinar is being recorded and will be made available on the PHCA website within about 2 weeks from today. The webinar has been approved for 1 continuing education credit for all attendees. For those who provided a NAB number, credits will be uploaded shortly, and we'll also share certificates for those in attendance. As we begin today, all attendees will be in listen-only mode. Please feel free to submit your questions via the Q&A icon on your screen, and we'll make sure to answer as many of those questions as possible at the end of today's presentation. And now I'll turn it over to Lindsay.
Hi everyone, my name is Lindsay Dymowski. I own and operate Centennial Pharmacy Services. We are headquartered in Philadelphia, Pennsylvania. I am here today to share with you a transition program that Centennial has. We work with facilities that are in and around the Pennsylvania states to effectively transition patients from a facility to home by managing their pharmacy care and helping support your metrics to make sure that they stay home and don't end up back in that facility. I am going to turn off my camera and share my screen, and we will get to the presentation. I would love if we can keep this interactive. Please feel free to message me with questions if you're not comfortable putting them on the general chat. I will definitely get to all of them. Thank you. Okay, let's get started. So, transition care is what Centennial calls this program. It is a medication management program at the point of discharge. What that means is Centennial can come in and support your patients after they are receiving care in your facility. So this does not affect the pharmacy care that is currently in your facility. This just supports the patients once they are in their home. Prescription medication, as we all know, is a patient's biggest responsibility. Up to 30% of prescriptions that are prescribed to patients are never filled, and over 50% of medications are not taken as prescribed. That non-adherence is what causes a lot of the issues in healthcare, such as increased costs and rehospitalizations. In the Medicare population, which I know is what we are mostly dealing with together, 81% of the population has 2 or more chronic conditions. Unfortunately, 70% of those patients are considered non-adherent to their medication. Furthermore, 1 in 5 are actually readmitted within 30 days. Oh, sorry about that. Are readmitted within 30 days to a facility. These individuals who are chronically ill and aging in place are overwhelmed with their pharmacy care. We typically see patients like this, whether they are in the community or coming out of a facility. They often have multiple doctors, multiple medications. Some of these medications are brands and generics that just happen to be overlapping on their medication list. So Centennial's goal really is to take all of these medications, organize them, make sure exactly what the patient is supposed to be on coming out of that facility is known by the providers that are in the community, known by the patient, and known by the patient caregiver to help support them when they're at home. The gaps that we see with patients not taking medications have rippling effects. So when it comes to our hospitals, up to 10% of the admissions in hospitals are considered preventable. Those admissions are mostly due to non-adherence. Our PCPs in the community have limited time, they have limited resources, and they're a lot of times so focused on the quality metrics that are given to them by the overarching ACOs or perhaps the care networks that they're a part of, that they don't have enough time to truly consult with the patient. We know that our acute care facilities tend to be a revolving door with readmissions, and that's one of the reasons why I'm here talking to your population today. The payers, as we all know, are struggling to get the members who need help, the help that they need in their home. And we also find that the payers, I'm so sorry, I'm not quite sure why this is still timed. We also find that the payers often find that the processes that they put in place for patients aren't continued once the patient is on their own back in their community. And then, of course, when the patient is in home, there's a puzzle that the in-home providers, from the social workers, the home care, health aides, and case managers have to piece together. And that often leads to making ill-informed care decisions. Then we have the patient who continues a non-adherent path, and their caregivers become just as overwhelmed as they are with their medications. So what if a pharmacy has found a way to close those gaps? That's exactly why Centennial is here. Patients know that medications keep them alive, and there's a lot of data out there that states that patients would prefer to skip their PCP appointment than they would over picking up their medications, which means patients know that they need to take medications to support them living a happy, healthy lifestyle. We utilize not only that behavioral trait for patients, but also an accessible and clinically based workflow for patients and care teams so that we can utilize pharmacy services for patient success. The platforms of our service include clinical pharmacy initiatives, meaning that the patient is receiving the same level of pharmacy care in their home that they would receive if they were in your facility still. We have clinical pharmacists on staff that are supporting those patients, offering the counseling, the education, and other services via telehealth or in person, meaning yes, we will go to the patient's home. There's coordination of care. So our team here is focused on making sure that everything that happens at your facility is also continuing to happen at home, meaning we're making sure that that PCP knows what went on in the facility in regards to the medications, and the patient doesn't go to that 10-day appointment and get put back on all their old medicines. Unfortunately, we see that a lot. We like to stop that. We do have an improved dispensing system and way of organizing medicines for patient that actually multi-dose packs them, similar to how you will see it in a facility. That patient can get that same multi-dose facility packet in their home. It's dated, time, day of the week, when they're supposed to take their medication. We can also make sure to color code it, to put different languages on there so that it's completely customizable for the patient. And then, of course, we have our different management systems, our care teams, and our metric goal analysis and support to help your team meet the quality of care that you want to meet for your patients. So again, we call our model medication management. What we like to do is have all of these pharmacy services, from adherence packaging, making sure the medications are synchronized, providing that clinical service in the form of what CMS calls medication therapy management, different collaborations and transition of care programs, combine that with delivery, communication, and then any other pharmacy resources that patients may need, and that enables us to maximize and diversify our pharmacy service so that we can provide patients all of the support that they will need. This right here, particularly the delivery, the med synchronization, and the adherence packaging I'll call them the heart of our business, where we will actually work with the patient, see how they're taking their medication, make sure that it's packaged and synchronized to a date and time that works for them, and then of course make sure that they continue to get their medication when they're supposed to get it. A little more in-depth into our process. So we will receive a referral from a provider source or from a discharge team. We're always making sure to call the member, let the patient know who we are. We typically have an introduction from that provider as well. From that point, we're reviewing the medication list, the clinical notes, anything that we may get from that patient. When we are doing that, we're looking at everything that's going on that patient's medication list. What interactions are they going to have? What's the drug utilization? Is there anything that has to be optimized, particularly for their insurance? Are there brand or generic things that we can do to help save them money? Does the patient have issue affording their medications? How can we support the patient with their copays? And then, of course, looking for our clinical polypharmacy issues. So we'll contact the prescribers and the care team as necessary. Particularly for a discharge team, this means collaborating with not only the discharge team at the facility, but also the provider and the community. If there is some type of medication change or a hospitalization event, we will essentially go through, contact the prescribers, do this whole clinical review again, and then start the process over. But from there, we bill package medications in our care packs, which you can see a sample of right here. The member will receive their care pack. We actually take all of the old discontinued medication out of the house. So we know that the only thing that the patient is going to be taking is their medication that they are supposed to be on. We'll contact the care team, let the facility and the provider know that the patient is set up on Centennial. Of course, follow up with the member, and then we cycle them into their monthly care cycle. And that monthly care cycle consists of a sync call. We call them care calls, making sure that their medication list and any clinical notes are sent over to the providers for review with whatever may be necessary. We'll bill and package their medication, and then we'll deliver it. And then we will keep the patient in that cycle. When a patient is getting discharged, we'd like to do it for a minimum of 90 days to make sure that we do have that period of time to meet that quality metric on the facility's end. The patient can choose to work with Centennial for 30 days, 90 days, 90 months. It doesn't matter. However long they would like to continue on Centennial, we are there for the patient. We like the experience to be very streamlined for everyone. So first and foremost, the partner who we're working with, in this case, it would be the facility. We want to make sure that there's a process that is customized to your workflow, that you're getting the benefit of the clinical pharmacy team reviewing the medications as discharge, and then you're getting the follow-up and collaboration that you need. The patient is getting their medication synchronized, packaged, and delivered to them. We're supporting the patient and their caregivers with whatever they may need in regards to pharmacy care. Do they need OTC products? Do they need any type of bedpans or diapers? Do they need DME? What's going on with their copays? Is this patient going to have an issue affording their copays? What can we do to find solutions for that? And then, of course, the care team in the community, we're making sure that that provider team knows that we are the point of contact regarding the medications. They have confidence in the pharmacy care, and they can call the pharmacist that is working on that patient 24/7 and get all the information that they may need. Our goal truly is to work with each facility individually to customize a solution that is needed for you. So I'm going to get into the data here. There's a couple of slides of data that I'm going to share with you. First and foremost, this is a patient that was referred to us November of 2020. About 8 months later, July of 2021, you can see the difference in their risk scores. So what this indicates is this was a patient who was sent over to us, extremely high risk for a rehospitalization, and also had some significant drug therapy issues. Once that patient was on our service, we were able to get them down to extremely low risk, minimize their risk for hospitalization, and then also get down decrease all of their drug therapy issues. So this is how we like to keep all of our patients on our system. The patient on the left here is typically how we end up getting patients. Unfortunately, most of the patients that we see are those chronically ill, those who are coming out of facilities, those who have multiple chronic conditions and look like this. And this is how we like to make sure a patient is appearing. So we know that when we're taking a patient on, we can actually work with them to not only make their pharmacy care easy for them, but impact their healthcare. We know that we're impacting their, not only the healthcare that they're receiving and how they're feeling on a daily basis, but we're also helping the providers with their quality metrics and bettering the quality metrics for their providers. This right here is a little bit of information from a study that we did with a small ACO back pre-pandemic. So this green line right here are non-Centennial patients. This blue line are Centennial patients. So we followed these patients for a year. These non-Centennial patients, you can see their adherence stayed hovering around 50% or so. We started in similar positions. The adherence over a year for the Centennial patients was up to nearly 100%. And we can proudly say that about the majority of our population. You can also see here this rehospitalizations. This is probably the one that's going to affect your population the most. Again, the green is the non-Centennial patients, blue are the Centennial patients. You can see that our hospitalizations decreased significantly down to almost 40%, while those rehospitalizations stayed around the 70% mark for these individual patients. And then, of course, again, because we are community focused, we do want to make sure that we're helping those PCPs get their quality metrics too. So MedRecs post-discharge, number of generics, and of course vaccinations, which are so important now. We were able to get all of those numbers up. One more slide of data. This right here is our equipped outcomes. So what this really shows is on the pharmacy end, how our pharmacy is measuring to other pharmacies in the community. So you can see here, PDC means proportion of days covered. This is an adherence metric that we follow in the pharmacy world. You can see that our cholesterol PDCs are high, our diabetes PDCs are perfect. The high-risk medications metric that we follow for patients, that's most likely as low as we are going to get that, considering aspirin is a high-risk medication. Then we have all of the other different metrics that we follow, such as our statin use and so on and so forth for patients. Our goal at Centennial is to make sure that the patients are taking their medications as prescribed. We know that if we can support the patient, get them taking their medications, we can have this type of impact on our quality metrics. And if we're having this impact on ours, we know that we're supporting the providers and the facilities as well. Two other pretty significant numbers that I always like to point out is our average med adherence rate for all of our medications, not just the ones that are measured by the insurance companies, is 98%. And then we also have a 76% renewed prescription rate from the prescriber. One of the reasons why that is such an important figure to point out is because typically a patient is left on their own to figure out how to renew their prescriptions. A pharmacy will press a button and ask for a refill electronically. And then if it doesn't come, it doesn't come. And the patient is left kind of figuring out, calling their doctor, wondering what to do to get that refill. At Centennial, we make the refill process our responsibility, not the patient's responsibility. And we like to actually support the patient through that. Reach out to the doctor from our team and say, hey, Mrs. Smith needs their diabetic medicine. And if Mrs. Smith doesn't get their diabetic medicine, this is what we can expect. So even if the doctor does want that patient to come to an appointment prior to giving a refill, we'll initiate a three-way call with the patient and the provider and our team, and we'll say, okay, Mrs. Smith, we need to get you your medication. The doctor needs to see you. What can we do to get you an appointment so that we can get this medicine over? And that's part of the initiatives that Centennial makes to go above and beyond to make sure that we are getting the patients everything they need and fully supporting their pharmacy care. So to get out of some of the data pages, I'll just share a little bit of the Centennial difference. So again, the whole point of this is just to share how true pharmacy support can be a medication management model that actually helps care teams succeed in their metrics. Our goal is, of course, to keep this patient healthy, to keep them adherent to their medication, and to support the facilities and the providers with their care goals. We know that we can manage high-risk patients. We can help your teams make sure that the metrics and the goals that you set are met. And we can streamline workflow and customize it to make sure that it fits within your current workflows. Centennial doesn't want to come in and change anything or interrupt what your teams are doing on a daily basis. We want to come in and offer support. So whatever way we need to do that within your workflow, we can make it work. So we have several programs that we work with facilities specifically. This collaborative alliance is probably the most popular that we work with facilities, but I'll explain all of them, starting with the green referral relationship. So I always say this is Centennial current status because we tend to get referrals from facilities discharging all the time. So every facility can send over a referral to Centennial once the patient is identified. That referral always contains a medication review, MedSync, the delivery, copays, education to the necessary teams on your end, and then of course we can send you the data as you request it. This collaborative alliance is more of a joint approach where we're actually working with you to determine what your metric goals are and how Centennial can support them. So that does focus on having a dedicated success manager, identifying goals, identifying patients, figuring out what type of data that is necessary for your teams to have on a monthly basis. We do request a minimum of 8 discharges. That's essentially 2 patients a week per month, just to make sure that we can properly support your team here. And then we like to essentially review everything. Once we get about 1,000 discharges or so from the facility, we'll review everything and say, okay, let's get some really nice data on the impacts that we've been able to make with this patient population. And we can review that and make sure that we share the data. And then we do have a few facilities who select to have an embedded partnership. This embedded partnership is essentially a Centennial team member at a facility, embedded with the facility on the discharge team on a daily or maybe a partial basis, essentially doing all of the identification and patient education and so on and so forth for the individual teams. We do request an onboarding fee for that, just to get the team member set up, whether that team member be a nurse, a pharmacy technician, or even a pharmacist. But we can go through and make sure that your team has a specific individual who is at your facility on a daily basis, working with your team to get these, get these patients set up for success. Our timeline is relatively quick, so we like to have everything really set up within 30 days. Once we identified that there is a relationship that we're going to work with, we will organize an email, whether it's Slack or whatever type of HIPAA preferred communication that your team has. We can set that up, get any account access, and then work on different workflows and approvals that your team may need. We'll come in, educate your team, figure out exactly who we'll be working with. That's the point that we'll do onboarding of the team member if we would have some type of embedded relationship. We'll start working together for the first 30 days and really figure out who are these patients, what are the different metrics that we're looking at, and how can we best onboard these. After that 30-day mark, we always stick around for any type of education that you may need, weekly, bi-weekly, quarterly, whatever meetings make sense for your team. Again, we like to reassess the workflow after that 30-day, well, typically after that 45-day mark, I should say, kind of figure out what's working, what's not, what do we need to tweak, and then we'll do a data pull. It can be 30 days, but it's usually better after 150 patients because we can really get some good quality data on the metrics that we're able to affect with those patients. And then, of course, ongoing just education, workflow reviews, communication with our team, and then meetings as necessary. And then we're at the 30-minute mark, and this is the end of my presentation. But when push comes to shove, when patients leave your facility, these chronically ill and aging in place need enhanced pharmacy care. We need to make sure that we're supporting these patients at home, just like they would be supported in a facility with their pharmacy care. Centennial can absolutely do that, and we hope to work with you to be able to do it on a daily basis for your team members and for your patients. This right here is all of my information. So my email is down here, as is my phone number. Feel free to call or text me. My line is always open. I am going to stop sharing my screen now and pop back up in video, and hopefully we can have some Q&A.
Awesome. Thanks, Lindsay. I'm looking at the Q&A channel and I'm not seeing any questions coming in, but I do welcome anyone who might have something. There's no bad question, right? So feel free to ask anything. Lindsay's here and happy to answer. I'll give everyone another minute or two to submit a question if they might have one.
I actually have someone who just sent me a question directly. It says here, how does this affect pharmacy in the facility? Well, one of the great things about this program is that this does not interrupt any type of pharmacy service that you are receiving in the facility. If you are in need of pharmacy service in your facility, or if your contract is in review and you're looking for pharmacy alternatives, Centennial is always here to support facilities. But we are community-based. Our main goal is to support those patients once they leave the facility in making sure that they are receiving the same level of pharmacy care at home that they received in that facility. So this does not affect your contracts or anything like that with any current pharmacy program. This is completely separate from that.
All right. I don't see any other questions coming through. As always, feel free to email myself or Lindsay after today's session if you do have something that comes to mind. If you email me, I'm happy to send it over to Lindsay's attention. And I appreciate everyone's time today. Thanks so much.
Thank you so much. It was great to get to speak with you all. I look forward to talking to you soon.
Thanks, guys. Bye.